Palliative care is a total active care of patients suffering from life-limiting illnesses along with the care of their families. It relieves suffering and improves the quality of both life and death. Palliative care can be given anywhere, at home or in the hospital. It should be part of existing health care at all levels of care. Home-based palliative care services is based on the concept of caring the patients at home. This is continued need-based care for homebound patients. This facility meets the needs of patients to be at home among their family and friends during a time in life when they are most vulnerable.
Today, palliative care is a most familiar word. Our government has also given special emphasis to palliative care in the field of health. But palliative care has been understood in many ways. When most of the people hear the word palliative care, they say that is about dying people and the care given to them. But that is not necessarily true. Today, the world is changing revolutionarily in every way. People are more desperate in his or her own case. Even for trivial things, people depend on machines, spending more time in front of TV and computer. Besides, with easy availability of motor vehicles and urbanization, man is prone to more diseases. As a result of all these, many people are now sick and bedridden in their own families. What kind of people can they be? People who are mentally ill, those suffering from congenital paralysis, those who are bedridden due to accidents and medical errors, those who are Medical Mission Sisters was founded by Dr. Anna Dengel, who took initiative in the field of healthcare. Giving more thrust to life and health, Medical Mission Sisters is a religious community that takes on challenges by working among the people and not limiting to
a place where we remain comfortable, relaxed, that. I think the number one reason is that many of the family members are not ready to take responsibility and give adequate care at home. One important reason is in a nuclear family, it is difficult to take care of sick people, especially for some husbands and wives who are employees. If a mother or father is bedridden, they feel it is a big burden. And no matter how much money you have, it is of no use if you do not have true love. And even if there is love, people are not able to express it. I personally know many such families. But on the contrary, we also come across those who take care of the sick with so much love, considering them as very significant members of the family. Such families experience a lot of prosperity and God's blessings as heard from their own testimonies. Another major hurdle is that family members do not have enough knowledge to see their patients' needs and care for them properly. For example, if a bedridden patient is discharged from the hospital and brought home, I have seen it in front of my own eyes. Many people who, despite having seen in the hospital several times and understood things like how can that patient be turned or made to sit up, brush the teeth, give food, be it through a tube or not, how can his or her elimination needs to be met, and so on, find it very difficult to manage the same at home. And I have helped such people whenever I meet them with such situations. When I see this, I remember my own mother. Maybe I learned the basic attitude towards nursing, that is tender, loving care, service-mindedness and so on, from my own mother. My mother, who was a housewife, has become the model for me. Once I remember the death of a parent in the neighborhood when I was 4 or 5 years old, the first death I saw in my life. Someone from that house coming and calling my mother. My mother's presence and caring for that patient, the trust and peace in her presence, the way my mother prepared that patient for his death, everything was such an insight for me. Later, I remember several occasions where other people in the neighborhood and my own family around sought for my mother's presence when such problems arose, and her intuitiveness and knack of being a source of solace and compassion. So also was my father's passion and good heart, who took a leadership position whenever there was an emergency and did anything and everything to help others. All these may have been the reason for me to choose even my religious life. Similarly, all of us, women, have a special characteristic. Do you know what it is? The desire to take care of fellow beings is a human value that we have been gifted with. This ability is seen in some men and in some children too. But many people neither recognize this ability nor use it. I remember, at the request of a boy, we went for a home visit. Let us call him Soman for the time being. What was a sight there? Soman's mother was lying unconscious in one room. Father was sitting in the next room. He could not walk. And that poor boy, Soman, was caring both of them very lovingly. We were shocked to see the arrangements Soman had in his mother's room. All what is needed for the care, not disposable things, and systematically arranged. And still, Soman, that young boy, asking me, "Sister, if anyone needs my help, my care, let me know. I will come to help." What a zeal! Indeed, a boy burning with the fire of caring. What has inspired me throughout my nursing profession is St. Matthew's Gospel 7:12, the golden rule that Jesus taught us, that whatever you want others to do for you, do the same. There is a patient on the last bed with a foul smelling wound, and it is unbearable for other patients too. Shall we ask the doctor to discharge the patient? I walked up to that patient, talked, and realized his situation. He was 55-year-old Velapan. His disease was a tumor in his chest, and pus was always oozing out. It was called a mediastinal tumor. He had 6 children. 5 of his children abandoned him when they came to know that he had this disease. He was brought to the hospital by the husband of his youngest daughter. I felt disturbed when I heard that a patient had been discharged because of foul smell. I sent word to call 2 or 3 nurses who were undergoing palliative care training and were posted in nearby wards. We discussed the matter and decided to contact the son-in-law who brought him to the hospital. He was a KSRTC employee who came immediately. In order to check his rapport and attitude towards the patient, I made a small list of items needed for a wound dressing and asked him to buy those and come. He brought them soon without any hesitation. Then I took the initiative to make him stand close to me and taught him how to do the dressing by giving him gloves, etc. When the dressing was over, it was around 3 o'clock in the afternoon. He came to my office and said he wanted to take his father home as he was confident enough to do the dressing at home and to please get him discharged. And so finally, the patient was taken home that afternoon. 2 days later, I felt a discomfort and wanted to know how that patient was doing. Learning that the house was near, I went to visit him along with two nurses. While we were nearing, we saw a crowd of people walking up and down in the house and making noise. I wondered if something happened to Velapan. When we got closer, we realized that the daughter and son-in-law, along with some neighbors, were busy preparing a special room for this patient. And surprisingly, we saw Velapan sitting with a fine dressing, much better than what we had put up on his chest. Using the basic principles of home care can do wonders in taking care of minor health problems of their own family members without going to the hospital. I would like to share with you some lessons that I have learned from my long experience with palliative care. I cannot give what I do not have. I can only give to others what I have cultivated in me, such as love, basic skills, and compassion for others. Similarly, we are obliged to give the Lord's love and mercy to others. If we do not care with love when we care for a patient, there is no joy or satisfaction in it. We should never sacrifice principles in patient care. Only then will that care be meaningful. Likewise, the conviction that my intelligence, strength, and beauty are free gifts from God, which can make us useful and inspiring members in society, as Pope Francis said. A life of caring has enriched my life. What if some of you could be carers? I assure you, yours will be joy, the kind of joy Jesus promised. Jesus said in John 15:11, I have told you these things so that you will be filled with my joy. Yes, your joy will overflow.
In this world, with full of hardships and sufferings and pain, if one person can create a little peace and happiness in another's heart, even for a day, that is the only ultimate truth. As Swami Vivekananda said, everything else is just me. and Good Samaritans.